Welcome to Engaging with Self-Ligation, a series of short modules where topics surrounding self-ligation will be discussed. My name is Dr. Lisa Alvitro, and I have 25 years of clinical experience and over 15 in self-ligation. Today's topic will address achieving your goals with low force and light wires. Joining me is Jennifer McWhinney with over 17 years of clinical experience. Achieving your goals with low force and light wires. Small diameter wires with low forces can produce significant movements. And if you're not used to using a self-ligated appliance, you might not consider this possible. And I think this is one part where self-ligation really is an advantage clinically, and it's an advantage to your patients. So let's take a look at initial malocclusion. So usually our initial wire is an 014 super elastic night tie. At bonding, this was our initial malocclusion. This is when our patient returns with their first adjustment appointment, and you'll see that deflection still remains in that arch wire. The one thing that's really hard, I think, clinically is to train yourself to not want to keep changing arch wires. Anytime there's any deflection in an arch wire, it can produce movement. Now, if you're not in a self-ligated system, you may look at this and think that's not enough deflection to actually produce any tooth movement. And that may be true if your brackets are ligated, but in self-ligation, that is enough deflection to continue the movement. So I encourage people to leave that arch wire in place. This is the second visit. Now the time frame between these visits is about 8 weeks, and look at how much you've achieved. So all of that on just one simple arch wire. So avoid that temptation to change those arch wires. Change them only when they're passive. An arch wire that's deflected still has movement. It still has force. It still can create a movement for you. And here's what I challenge people. See how small wire you can use to achieve the movement that you want and how few of wires. And I think one of the concerns that people have about this is, well, my patients expect wires to be changed every time. And, I think Jennifer can give us some insight on that. I mean, how do your patients feel when you don't have to change an arch wire?
I think as long as they are seeing change in their teeth, they don't know how many arch wires they need during their visit or during their treatment time. And as long as they are seeing change, they're okay with keeping the same arch wires in.
Have you ever had anyone disappointed that you didn't have to change their arch wire?
No, I've never had anyone disappointed. They're usually excited when we don't have to do any arch wire changes.
Let's look at another case example, and I think not only are you seeing profound movements with a thin arch wire, and I think a lot of times we think about thin arch wires are just good for derotating teeth, and I think that's something that everybody uses as part of their clinical protocol. But I think you also need to see what kind of arch development you're getting, how you're eliminating crowding, and obviously at some point we're going to need to move on to the next arch wire because we're going to need to fill that slot, because once the deflection is gone, that means all the force is gone, and it is time to move on to our next wire. It's true in different types of self-ligation systems. Obviously, we're using Ultra. We could use Smart Clip for over 15 years, and you can see the profound movement that you can get just on a 14 super elastic night tie. And the reason why is because you need just enough force to move the teeth. You don't need enough force to overcome the friction or resistance that's in the posterior. Let's look at another case, and you'll probably remember this young man, Jennifer.
I do, yes.
And the nice thing about is, being able to make these profound of changes in just that arch wire. Now, you may look at that little green tie and think, well, why did you put a tie there? And we'll talk about this later, or I'm sorry, actually we'll talk about this in another module, but you're going to have to learn to secure arch wires too, and that's just really one simple way that we would secure arch wires, just by a little crisscross tie, because we really want to maintain the arch wire in the midline, but we want to allow the arch wire to express itself out the posterior. Now, when he came in for his first appointment, there was still deflection, so we allowed it to completely express itself. You can see how much alignment we're getting. And this is something else I think that you really need to consider too in a self-ligated system, is that if you look at that in those incisor position, you would assume that if you were to go ahead and tie that entire arch wire in, like if you're in a ligated system, One, you're not going to be able to produce this amount of movement, I believe, on the 14-night tie, but you'd also see excessive flaring. Well, yes, we do have an overjet, but you have to remember he was significantly class 2, and we're going to address that class 2 later. But if you look at the incisor position, you don't see an excessive amount of flaring. Now, here's another optimization type trick for self-ligation. One is we like to disarticulate the occlusion, because here's what you need to consider. You've got your bracket, which is basically your handle. Then you have your archwire, and again, you want to go as small as possible to produce the deflection, to produce the force. But what other forces are acting against us? One, obviously, you've got to have force to move the teeth, to stimulate the periodontium, to initiate the bone response, but you also have the force of occlusion. And sometimes when people think they need to use heavy wires, what's interfering is the force of occlusion. So if you disarticulate someone, you're removing that force. And what I mean by force of occlusion, if you think about cases where someone's really locked in, there's cusp interdigitation, that you may find that you have to use larger wires just to not only overcome the force of the friction in the system, but also that force of occlusion. So when you disarticulate people, it's really easy to enhance the movement with self-ligation. And this is just a technique that we use. Location as far as where those stops are going to be. Sometimes they're in the posterior, sometimes they're in the anterior. It really depends what you're trying to accomplish, but disarticulation will really help you get full expression of that archwire and produce the movement that you're looking for. And when I started really disarticulating people, either in the anterior, sometimes people call them bite turbos or bite ramps, I was concerned that patients would not accept them or have a difficulty with them. And so that's where I kind of rely on my clinical team. And Jennifer, I think, would like to comment on how do patients feel about when we create their little bite turbos or their bite cushions to disarticulate them.
At first, they're kind of a little leery, but we show them the different collars that they can get. And once we put them on, they don't seem to mind them at all. And they just love picking out the different collars and showing their friends and family.
I think one of the things, too, to consider if you're going to disarticulate someone is you need to keep it equal bilaterally. Sometimes colleagues will say, oh, people don't like when you put something in their bite. That's true if you make it asymmetrical, if it's not equally distributed. So, once we get our bite turbos or our disarticulation pads in place, we're going to adjust them to make sure that they're closing evenly and they're comfortable. We also then to verify that they're not in occlusion. Now, here's something you have to keep in mind too, is that these can wear down because you're going to want to use a material that's softer. You're not going to want to use like a restorative composite. So, often you'll find these wear down, particularly in some of our kids that are grinders that have a bruxism habit at night, that you can't really make them a night guard, but in their initial wires we'll put these bite turbos in. But you have to really keep an eye on them and make sure that you're staying out of occlusion, one, to continue to enhance the movement, and two, to make sure there isn't any bracket interference. Now, another optimization tip too to be able to use thin wires is you're going to want to engage the most rotated or displaced tooth first. I think our natural habit is you do the easy part first, and then you do the harder ones last. But here's what happens when you do that is that you use up wire. If you think about it, to be able to get the deflection, you need to have more arch wire present. So if you were to go ahead and tie in like if you're in a ligated system, then I'm going to tie that rotation in last, it becomes harder to deflect the wire. The same is true with self-ligation. Train yourself and your staff to go ahead and tie in the most rotated for teeth, or I'm sorry, actually close the door. We don't need to tie, which is great. Close the door around the most rotated tooth, then engage the rest of the arch. And I think, here's another good example, and Jen can kind of point out where you'd want to engage that arch wire first.
You would start with the upper left lateral and then go to the central and then back to the cuspid on the left side and just work your way back.
Yes, I think the natural tendency, you'd start here and do the easy side and then do the harder side. But again, you're going to take up more arch wire. And if you look at that deflection of the archwire, you can see you're going to produce a force. And even though it's a very thin wire, it's going to be enough, because what's going to happen here is this archwire expresses itself is it now can slide out the posterior. And that's one thing we'll tell people to expect is this archwire may get a little bit long. So maybe you're going to want to turn it or make sure it's definitely flush, and then time your appointments accordingly. One thing is I have this arrow here I need to point out. Everyone always asks me, no, that's not a cavity. It's just a restoration that was done from the side before the other tooth had erupted. As we're looking at these cases, I think that when you're thinking self-ligation, people tend to just look at crowding. They look at lower incisors and how am I going to get the wire in there and close the door? Well, you're going to engage that area first. And what they really miss out on is one of the big advantages of self-ligation is that reduced resistance in the posterior. Because, if you were to take this cuspid and tie the entire arch in, you'd really see significant bite opening. You'd also see flaring of the incisors. And when you look at where we're at now, and all that was accomplished on that initial archwire before we were changing to our next, you can see we've got nice arch development. We've been able to bring down the cuspid, create sufficient space for that. And you'll recognize this is one of those, that very first slide we looked at. So 2 appointments to get to here. And through disarticulation too, we were able to jump the crossbite. So when you're starting a case that looks like this, my first thought is, what wire am I going to use? I'm going to use a 14. Maybe some people might use a 12. I need to disarticulate, because there's a really good example of force of occlusion. And if you keep that in that position, you're not going to be able to really jump that effectively. So if you look real close in the back, you can see that he was disarticulated, and we disarticulated enough so that initially he could clear that. And you saw that in the initial slide. We're able to jump the occlusion. Now, here's something I think is really exciting, is that look at the torque, or look where that root was at. And now if you look where it's at, you can see how much of that root has come forward too, because again, that's something that can be really tricky in a crowded case, is that the anterior teeth come forward and they flare, but it leaves the root behind. And then you spend a lot of time torquing and trying to get the roots in the right position. And if you look at where we're at now, I think that was really exciting. Really exciting for me. I think it was exciting.
It was very exciting.
Yeah. And also then too, once we were able to disarticulate him, as teeth line up, it was able to help adjust the midline as well. So, I really encourage people, if they're new to self-ligation, or maybe they've tried it before and they want to try it again, to think of not only the effectiveness in resolving crowding, but also how that lack of resistance in the posterior can really help align the dentition, develop the arches without significant flaring. Because that's one thing that you spend a lot of time trying to recover, is once there had been a lot of flaring in the dentition is coming back. Kind of this I think is a really good example too. And Jennifer, I think this is one of the patients that that you're involved with, and you can kind of see how much movement we were able to achieve just this thin wire. Some may choose maybe not to completely engage that, but because of the fear of excessive flaring. But if you take a look, you really have brought that in. You've got the arch development. 2 appointments later, this is where we're at, and we didn't excessively flare. Now, if you would have tied that in with a ligated bracket system, and particularly all the ties in that posterior, you would have seen significant bite opening. You would have seen flaring of the upper incisors. And I think that's where you have to go and start using a lot of heavier wires, because you're trying to overcome some of those iatrogenic effects. You're trying to decrease torque in the anteriors. Today's topic was achieving your goals with low force and light wires. There are other topics that will be available as part of this series.